This is a fascia stretch for the low back. I have known this stretch for a year, and in this year, it has relieved my own low back pain, countless students' low back pain, and it has helped people with nerve pain going down their legs and into their feet have the nerve pain disappear. So I want to share it here with you. You need a wall, and you do legs up the wall. Now I'm going to be able to get my legs really close to the wall because my hamstrings are pretty flexible. It doesn't matter how close to the wall you get. So wherever you get is good. If you have flexible hamstrings, the way you get there is you put your hips up the wall and you come onto your back and bring your legs up the wall. So this is the first part of the pose. I'm going to teach it to you in sections. So you can, if your hamstrings are tight, what matters is that you are comfortable. So you can have your hips quite far away and you want to have your legs going up. Start to breathe deeply. And as you breathe deeply, let your pelvis and your sacrum and your low back relax into the floor. One more breath. And I'll introduce you to the leg part of the pose. So your legs are up and you turn your feet in a little bit pigeon-toed. And you invert the feet, which means the inner part of your foot pulls towards your inner knee and the outer part of your foot goes away from your knee, and you start to reach your heels up toward the ceiling and you tighten your thighs. So you're breathing deeply. You're reaching the pinky edges of your heel up toward the ceiling. You're allowing your pelvis and your low back to relax into the floor. You're tightening your thigh muscles. So that's the first piece of the pose. So let's relax. When you're relaxing, you can let your legs come into any position that's comfortable for you. Next, I'll teach you the arm part of the pose. You bring your arms straight up toward the ceiling, and you extend the wrist, which means your palm of your hand is pointing up, and you externally rotate your hands and arms, which means your thumbs point to the outside and your fingers point toward your feet. Breathe deeply. The arm part of the pose, once you have the extension of the wrist and the rotation, is the arms come over the head as far as is comfortable for you. So I can bring my arms all the way by my ears, but it doesn't matter. You can have your arms be straight up. You can have them as far toward the ears as works for you. What I like to do when I'm bringing them over my shoulders, over my head, is to move my shoulders so I make room in my clothing, because I want to be able to reach the shoulders up toward the ears. So let's play with the arm positioning, what you do once you're in there. So bring your hands into the working position that you're going to use right now, and add the extension again, and add the rotation. So now your fingers, if your arms are overhead, your thumbs point to the outside and the fingers point to the ceiling. Breathe deeply. Start to reach the heels of your hands away from you. So if they're overhead like mine, you reach your hands overhead. If they're up, you keep reaching them up. So you're breathing deeply, reaching the hands, stretching the heels of the hands, straightening the elbows. And then we'll bring one arm down and the other. So that is the arm part of the pose. What goes with it is an action in the throat. So the base of your throat, which is where your tongue muscles are, you contract the base of your throat, like you're doing this interesting thing with the base of your throat. And what that does is it lengthens your neck, takes the curve out of your neck. The skull you lengthen your skull away. And if you feel like you can, you lift your skull slightly off of the floor. It doesn't have to be a huge lift. It could be just as high enough so a piece of paper can slide between your skull and the floor. And if that's too much for you, you don't need to do it. And the gaze looks down toward your knees and toward the pelvis. So those are the pieces of it. And now we're going to practice putting all the pieces together. Bring the arms up. Extend the wrists. Internally rotate the legs. Invert the feet so you reach the pinky edge of the heel up. You flex your feet, which means pull your toes back towards your shins. Begin to breathe deeply. Bring your arms into whichever position is right for you in this moment. Add the external rotation and the extension of the wrists again. Look down toward your knees, toward your pelvis. Contract the base of your throat, lengthening your neck. Lengthen out of the crown of your head. And if it's doable for you, lengthen your skull off of the floor. And you have a lot of oppositional movement happening here. The heels of the hands and the skull are reaching one way. The sit bones are lengthening toward the wall. You're breathing deeply and allowing your low back to hang into the floor. Reaching out of the heel, pinky edge of your heel as you reach out of the heel of your hand. Tighten your thigh muscles. It's very, very active, stretching the fascia of the spine. One more breath here. And then allow the skull to come down. Relax your throat. Bring one arm down and the other. Relax your legs. Finally, relax your gaze. And breathe and just let yourself feel what kind of changes you might feel in your low back. Feel it's quite a significant effort. Uses a lot of muscular effort, lengthening the fascia of the low back. So feel you can just relax and recover from the effort. And we're going to do the pose again. The low back fascia stretch. So your legs first go up and into the pigeon-toed position. Pull the toes back toward the shins. Invert the feet so you reach the pinky edge of the heel up toward the sky. Bring your hands into the working position, the angle that's right for you. Extend the wrist. Externally rotate. So the thumbs point to the outside and the fingers point more up or forward, depending. Using your deep breath. Start to look down. Contract the base of your throat. Lengthen out of the crown of your head, and if it's right for you, lift your skull. It's not so much a lift as a lengthening that creates the lift. And we just keep going through the cues as you breathe deeply. It's the combination of these reaching of the arms and the legs and the feet and the rotation combined with the breathing. So your sit bones lengthen toward the wall as your crown of your head lengthens the opposite direction. Breathing deeply, the low back relaxes into the floor. The heels of the hands and the heels of the feet reach away. The base of the throat contracts, lengthening the upper part of the spine as the sit bones lengthen toward the wall. Let's do one more round of breathing and reaching. And then relax your skull. Bring one arm down and the other. Relax your legs, relax your throat, relax your gaze. Let yourself feel the benefit of the pose. If it's comfortable for you, you can bring your legs into a bent position, which is a supine child's pose. Letting your low back relax. And then come onto your side and make your way back up, either into a seated position or a standing position, and feel for the benefit in your low back. So if you were having low back pain, feel that. Come up into standing and feel the shift in standing and walking. If you are having nerve pain going down your legs, feel what's shifted there. Feel what's shifted in your body. And that is the low back fascia stretch.